Hi again. Let's recap on justification. European guidelines say that all X-ray examinations must be justified on an individual patient basis by demonstrating that the benefits to the patient outweigh the potential detriment. The anticipated benefits are that the X-ray examination would add new information to aid the patient's management. Justification is different from optimization. Optimization relates to the equipment and techniques used to produce an image, after justification of the need for a particular radiographic view has been established. If you take or prescribe X-rays, for example you are a radiographically qualified DCP or dentist, you need to know that the particular view is justified. Justification is about balancing risk and benefit. All dental X-ray exposures present a risk to the patient of genetic damage or cancer. The risk with dental X-rays is very low, but with millions of people receiving dental X-rays, the danger is real. It's important that there are going to be known benefits to the patient of having the X-ray taken. The benefits will include helping to diagnose the presence and extent of dental disease, or the absence of suspected disease. This will help to ensure the patient receives the correct treatment, and will prevent unnecessary treatment from being undertaken. This means that the patient must have had a dental examination before an X-ray is taken, and the risk of the presence of disease established. It's not acceptable for a practice to use so-called screening or routine X-rays before an examination has been done, or if no disease is suspected. The United Kingdom has 4 rules regarding justification. Firstly, the intended exposure must be assessed to ensure that it will lead to a change in the patient's management and prognosis. Second, it must be authorized by what the rules call a practitioner. The practitioner is the qualified dentist who provides the justification reasons. Thirdly, every exposure should be justified after taking into account the availability and findings of previous radiographs and the total potential diagnostic benefit to the patient. Finally, the need for the radiograph must be related to the history and examination you've performed on the patient, the radiation risk of the radiographic examination, whether there are other ways to gain the information, and whether the X-ray views chosen could be done with a lower dose. So that's justification. In the next lesson, we will look at how we can optimize the X-ray set.